Hi, Naz. Welcome.
Hi, Mara. How are you?
Good. Can you see and hear me okay?
Yeah, I can.
Okay, perfect. Good. So I think we'll go ahead and just get started. We have about 25 people with us, which is super exciting. Thank you all for joining. We'll try to address your questions toward the end. So please put your questions in the chat and we will get to them. Not a problem at all. So first of all, I would like to welcome you all to our ASDS True Skin Experts live session. Just to let you know that the ASDS is the American Society of Dermatologic Surgeons, and we really try to feature some of our excellent members and inform you all that we are the true skin experts. We've all gone through many, many, many years of schooling, which I'll let Dr. Naz tell us about a little bit. And we really want this to be an informative session to help guide you as you choose your dermatologic surgeons or your cosmetic surgeons. And yeah, we're going to be talking all about reversing the clock and laser and light-based procedures. And I'll just introduce myself quickly. I'm Dr. Mara Weinstein. I am an assistant professor at the University of Rochester Medical Center. I work with residents, so I'm in a training program. I teach residents every day. I also speak nationally and go to various meetings and speak on different podiums there. And I actually know Naz from two different worlds. We were both Princeton Tigers, and back in the day, way back in the day, and we also completed the same fellowship program in lasers and cosmetics. So I'm super excited to have her here with us, and I will go ahead and let her introduce herself.
Hi, I'm Naz Saedi. Like Mara, went to Princeton and I completed my fellowship like Mara did at Skincare Physicians. I was at Thomas Jefferson University full-time for 9 years, and I just left a year ago to join a private practice outside of Philadelphia. I'm still actively involved with the residents at Jefferson and on volunteer faculty. And like Mara, I travel nationally and internationally to lecture about lasers and cosmetic dermatology.
Wonderful, great. So this session is focused on laser and light-based procedures, which Dr. Saedi and I do a ton of. And so I thought it would be most appropriate and helpful for our audience to kind of do it in decades. And so I'd love to start with the 20s and just kind of pick your brain and see, when a patient comes in, let's say she's treatment naive or he is treatment naive, and they want something to start, they're starting to see the beginning signs of aging on their skin, and they want you to help guide their treatment plan. So how does that discussion go, in your office?
Well, first of all, if they're treatment naive, I want to make sure that they are using the right skincare first. So I love everyone to be on a retinoid, sunscreen, and a vitamin C. So those are my three main must-haves. I try to keep it as simple as possible. And then if they're interested, particularly like in the late 20s, I'll start with injectables. And then device-wise, I have a lot of patients who have sun damage. So we could start with something like IPL or BBL to treat their brown and red from being out in the sun. And then if they have issues with their skin texture, we'll discuss very gentle laser procedures like Clear and Brilliant. Personally, we have the Moxie laser. You can do a gentle Moxie, which is a 1927. It helps with brown. It helps with pores. It, helps with fine lines and wrinkles. So it's just kind of like a gradual approach to introducing them to the appropriate skincare, but also cosmetic procedures.
Yeah, I'm very similar in that. I see we have a bunch of people tuning in who might not know what some of these devices actually do. So why don't we get it? You said that you might have them do a BBL or an IPL. So tell us a little bit more about that. Like, who is your ideal patient for that procedure, and what are some things that they need to know, let's say if they're interested, before they come in to have an IPL or a BBL?
Sure. So, IPL isn't technically a laser. It stands for intense pulse light. So it's a broad range of light. It's not a single wavelength. And by having a wide range, the device is able to target browns, it's able to target red. It's not specific just for one target. So people who have some freckling that they want to get rid of, or patients who have like some broken blood vessels, they would do great with them. Something like IPL. And BBL is similar. It just is the device made by Cyton, which is one that we have in our office.
Yeah, absolutely. And I'll just add in that with your IPL and BBL procedures, they're pretty minimal to no downtime. So if we're treating brown spots or lentigines, they can get a little bit darker, and usually it takes about a week and they'll kind of slough off. But otherwise, there's really no downtime associated, at least in my hands. Would you agree with that?
Yeah, I totally agree.
Okay. And then also, IPL, BBL, they're really great procedures, great for brightening. I think they have a nice place for like before events and things, just because what we mentioned. But it's a little tricky in the summer because you don't want to come in if you're super tanned. We would probably hesitate to treat you with an IPL or BBL. And so that's just a little, like pro tip. If you are scheduled for an IPL or BBL with, a provider, just make sure you go in and you hadn't just spent a day out on the boat, because it is pretty risky. And that's where somebody like Dr. Saedi or I would be able to counsel you as to when the most appropriate treatment time for that procedure is specifically.
Yeah, absolutely. And I find that doing them in the fall is our busiest time because people have fun in the sun, even though they're using sun protection. They're still getting sun exposure and sun damage, and then they come in the fall ready for a refresh.
Right,
Hi.
exactly. Hi, everyone. And then how often would you have your 20-year-old patients, let's say, do something like an IPL, since we're talking like deep diving into IPL?
Yeah, so if they want to start and they want to be on a maintenance program, then I think it's great for them to do it every 6 months. Sometimes if people have a lot of sun damage, I'll do a series, 2 to 3 in a row, and that's what I do for older patients. But oftentimes, and I never say just one and done, but for younger patients, I typically just do 1 to 2 and then put them on a 6 month maintenance plan.
Yeah, so important. It's so important to have a plan. So, again, if it's your first visit and you're seeing your derm in your 20s or whomever, and hopefully it's a board certified dermatologist, that, we would most likely talk about putting you on a plan and just making sure that we're on the same page. And that's how we get best outcomes. And, rarely anything is one and done. It's almost too good to be true if that's what you've been told. And I'm sure you hear it too, Dr. Sadie. People come in and they're like, oh, I spent thousands of dollars. And they said, after one treatment, I would be, this would be gone.
Right, and that's just like it. I just don't guarantee, and I also just don't tell anyone that everything will be gone. I say that things will look softer, and it'll be more subtle, but nothing's going to be completely gone.
Yeah,
I wish
absolutely.
I had a eraser, and I feel like so many get sent to me and they want that, but I just can't.
Right. No, exactly. So let's talk a little bit. So just to summarize, so if you're just joining, we just went over kind of like what Dr. Sadie would do, and I agree completely. If you were in your 20s, so if you came in your second decade of life, you're treatment naive, we pretty much outlined three things, which include skincare, so optimizing your skincare routine. Secondly, like just some injectables, so neuromodulators and fillers, but just very little tiny amounts. And a gentle laser and light-based procedure like IPL or BBL. And so let's move on to the 30s. So how do you counsel that patient And maybe like give us an example of somebody you saw in the office today, if you can think of someone.
Well, I mean, an example of someone I saw recently is or yesterday, a 33-year-old. She's getting married, and she basically wants to treat multiple different things. It's the wrinkles on her forehead so that her makeup doesn't crease in photographs, her smile lines, but also just wanting a more defined profile for photos. So some skin tightening as well. And then also enlarged pores. So the treatment plan would be to do a little bit of neuromodulator with like Botox to soften the forehead lines and the 11 lines. And then for the laugh lines, a little bit of filler. For the pores, doing a light resurfacing laser. That could be like a Fraxel, a Clear and Brilliant, and we'll get back to what all of that is. And then something for skin tightening. So we like doing radio frequency. I know you like, we have the temperature, so I love that for tightening the jawline. It heats up the collagen, which then stimulates new collagen. So then you have tighter, more lifted skin.
And how tell us a little bit more about temperature. So that sounds so interesting. And like you said, appropriate early as your 30s. So is that how long does that treatment take? Is it painful? Is there any downtime? So we're talking about a skin tightening
Yeah.
procedure.
So it's not like we love it in our office, and actually our aestheticians do it with our supervision. Patients typically come in every 2 weeks. It's a 15-minute appointment, and it gently heats up your skin. You get a little uncomfortable because there are some areas that become a little hot and uncomfortable. But for the most part, it's quite relaxing. I've had it done a few times. To admit, I'm not compliant. I don't stick to the every 2 weeks. But for my patients, I recommend them coming in every 2 weeks for 6 treatments.
Very cool.
Then it takes 3 to 6 months to see the ultimate result. That's one thing with skin tightening. You don't see the results right away, and it's important to counsel patients about that just because you don't want them to have unrealistic expectations. This isn't something I would do a month before the wedding and have them have their desired results.
Right. And that's a really good point you make, because I think that's another place where our training really comes into play is to be counsel patients and make sure that they know that things take time, because ultimately we're trying to stimulate your own collagen and elastin. You know, we know as young as age 26, we stop producing as robust collagen. Everything sort of starts, we start seeing the beginning signs of aging at that point. I don't want to say falling, but you get, that's kind of when we start noticing those first signs. So super important to plan your procedures and talk to your dermatologist about, what you have going on, and what does your social calendar look like, and how can we help you plan for that so that you get the desired outcomes on the date, so in your wedding or whatever it is. So let's do like a deep dive into like Clear and Brilliant or Moxie, whichever one people hear. Everybody hears about Fraxel. Like, what are these things, and why would you recommend them for someone versus another?
Yeah, so I think that for someone in their late 20s, early 30s, doing something like Clear and Brilliant or Moxie or Cool Peel, which we also have in our office, is great because it is making these little tiny holes in your skin, but keeping the top layer of skin intact. So you're not bloody, you're not oozing. And then those little holes that are made by heat basically stimulate new collagen to form, new elastin to form. So it's basically stimulating remodeling of your skin. And so the end result is your skin, the texture is smoother. So we do it in more aggressive forms for people who have acne, but we also do it for people to shrink their pores and with fine lines. I find this to be great in younger patients as like a rejuvenation. It gives you a glow. Your face is rough like sandpaper for about 5 days, and then it's really smooth and baby skin underneath. But everyone has different devices, so you need to be mindful of which one you're getting, because sometimes you go to a place and they might only have one device, and that might be too aggressive for what you need.
Yeah, I think that's such a good point. Definitely do your research. I mean, the world of lasers and light-based devices is so broad, and it's kind of like the wild, wild west in some areas of the country even. And I think it's so hard as a patient to know, what's most appropriate for you. And
Right.
so starting with a fellowship trained laser expert board certified dermatologist is a great place to get guidance and sort of help you with your treatment plan. Plus, if we don't have the right device for your skin condition, we can, like let's say you were going on a trip to Philly and wanted somebody there who is an expert who we trusted, I could definitely recommend you to Dr. Saedi or somebody in the area. So it's great network to sort of lock into when you're looking to do these laser and light-based treatments. Dr. Sadie, are you still there? We lost your live face.
Yeah.
Okay.
Yes, I'm all visitor. So sorry for that. And I was listening the whole time.
Okay, perfect. Yeah, great. So, can you tell us more about sort of what treatments, and we're talking about the third decade, right? So like everybody in your 30s out there, what treatments would you combine now? Like, everything has a price tag and takes time. And so what treatments would you combine to sort of expedite whatever, the desired outcome?
A lot of times what I combine is doing something that treats either pigment or vascular with texture at the same time. So combining IPL or BBL with a gentle laser like the Moxie, or even Halo, which is more aggressive, but really trying to target a few different conditions at once. But it's really important to break that down for patients, because sometimes they think, oh, I'm having a halo and that should take care of everything. But the reality is that's not going to do anything for your redness.
Right. Exactly.
How do you tell?
Yeah, I do the same thing. So, a lot of people want to come in for, their brown spots, but also want the resurfacing. So I will do the BBL first and then do the halo after. We're talking about a procedure that is more superficial, will help to lift some of the pigment off the skin. And then when we do the halo, that really helps with resurfacing and collagen remodeling, texture, fine lines, wrinkles, scarring. And so that's a really nice combo. And you're right. Like, so if we just did the halo, we wouldn't get the lifting of that pigment as efficiently, as effectively as if we combine the two. So that's exactly what I tell them. Um, let's move on into the 40s, because I think so now we've talked about like injectables and Botox and a little bit of fillers and skin tightening and lasers. Like, what else is there that we can do? Like, what happens when you turn 40?
Well, when you're 40, for everyone tuning in, I recently turned 40 in December, and I realized I need a plan. Like I need to like put myself on a plan and like stick to it. And I think that's what I tell patients. It's you really need to do these things regularly. So whether it is doing your BBL or doing the halo, it's not just come in, do one or two treatments, and then I'll see you later. It's really maintaining this and being on a program.
Yeah. So basically,
And then
so
all of the things, maintaining the skincare, Botox, filler, um, resurfacing.
yeah. So it's
And
sort of
then I'm seeing the lady derm docs say, what about 50s? 50s, it's like, keep it up. And then you'll look as amazing as those two do, because they look so young.
very true. I'm right there with you. Chime in if you have any commentary on the 50s. But I would also say to start considering things like biostimulation, right? So biostimulatory fillers. Wait till the 60s when you know.
My
So
God. No,
what fun. Um, so
it
so
does
let's
a full-time job maintaining.
yeah, it
Hmm.
is. So let's rewind just a moment. So this is so fun. So you sort of stopped in the 40s and we were like, you need to do everything we just talked about, but put it on like autopilot. And this
Yeah,
is like every month you're doing something, right? Or every few months. So I think that when you look at the big picture, if you start all of these procedures earlier on, like in your 20 or your second and third decade, you really won't have that much catching up to do. So it's really about that maintenance plan that we
yeah,
help guide you through, right? Would you agree with that?
totally.
There's
Totally. And that's like the whole concept of prejuvenation. One of our mentors, Ken Arndt, who's a giant in dermatology, coined this term prejuvenation that we hear all the time now. And it's basically doing all of these steps early on, starting in your 20s, so then you don't have heavy lifting to do when you hit 40 or 50. I keep saying 40 like it's so old, but like when you're 50, you don't have to do heavy lifting.
right. No, that's exactly right. I want to highlight a procedure that I think has a very sweet spot in like this 40 to 50 age range. And I know you or have some experience with it, but tell us a little bit about radio frequency microneedling and sort of, yeah, where does that fall into your plan?
Sure. So we do a lot of that. And oftentimes it's not a solo, like it's not a standalone procedure that's not incorporated with a treatment plan. But what it is that it is microneedling so that you're getting the injury from, I'll totally get back to that too. You're getting the injury from the needles going into your skin. So then that's creating collagen and stimulating collagen and elastin, but also the tips of the needles are emitting energy, radio frequency, which heat up the collagen. So you're having some tightening from the effects of the radio frequency, and then you're having the benefit of improving your skin texture as well. And typically, what I tell people is to come in for 3 treatments spaced 1 month apart, and we do that for tightening, for crepey skin, um, for acne scars. And we do that on the face, the neck, the chest. We do it around the knees if people have crepey skin around their knees, on the abdomen for women postpartum whose skin has stretched and then collapsed and stretched and collapsed. And we do that oftentimes in conjunction with biostimulants as well, which we can talk about, and I know you love too. But after they do the 3 treatments in a row, what we recommend is coming in for 1 treatment every 6 months as a maintenance.
Okay, perfect. And then let's sort of add the biostimulation component. So what's your favorite biostimulator and how does that, like, do you do it before or after? How do you time it? Because we know those needles can penetrate. Yeah.
Yes. So I either do it, and I let the patients decide, like, do you want to do a series of the RF microneedling? Then we can do the biostimulatory, like you can see where one gets you, then do the other, but it totally depends on the patient's preference.
Okay. And what's your favorite biostimulator to use? Or
I
do you
like,
sort of
yeah,
that?
you can use Radiesse, you can use Sculptra. I personally use a lot of Radiesse. Um, and I feel like it depends less on the patient than Sculptra does, but that's just my preference.
Yeah, no,
Yeah,
agreed. Yeah, agreed. I'm trying to get more patient convince more patients to do sculpture because I think it really has a nice place for some patients and you know that natural pan facial
right.
volume restoration. But I like Radius too. I think it's a little more user friendly and patient friendly.
Hmm.
Um, and so while we're talking about biostimulation, let's talk a little bit about, you know, like off the face. So I think a big part of turning back the clock, anti-aging, prejuvenation, and a nice place where we can bring in our laser and light devices is off the face. So like neck, chest, right? So what are you doing for the neck and the chest? What's your preference there?
I use almost all of my devices. You have to be careful to use the devices off the face because the rest of the body doesn't heal as well as the face does, and you can cause more injury like burns and scarring off the face. But for I do all the same treatments. So for the neck and chest, we do a lot of BBL, either with a 1927 or with Halo. We do RF microneedling to help with the crepey skin. But almost all of the devices that we use, we can safely use them off the face. But
Yeah,
that's all where I see the most complications come from other places is striping on the chest or on the back. And it's just something to be careful of.
yeah. So good points. I think that, if you take home one thing from today, it's to make sure that you um, don't ignore your neck and your chest when you're going to have these treatments. And I think, again, when you are going to derms that might not be, or not, excuse me, not derms. I'm getting distracted by all of our friends. Um,
I know.
if you if you go and see someone for the first time, make sure you ask, like, hey, we're doing this procedure on the face. Can we add on the neck? Can we add on the chest? And most often that's, our pleasure to do and something that would be reasonable. But I think so often we forget to even address those areas, and then it becomes like an afterthought. And
Yeah.
then, said there are areas that we see scarring and more complications. And so if you're playing catch up again with neck and chest, it can become an issue and a little trickier. Um, we're almost out of time. I feel like we're just getting to the meat of this. So I also kind of pivot and talk about treating skin of color. How do you, like, first of all, let's just tell our audience, are lasers and light-based procedures A, safe in skin of color, and B, what are some things our viewers should be asking of their providers when they go in and are considering lasers?
Um,
With
yes, they're totally safe with someone who's experienced, who knows what they're doing in skin of color. And I think that that has for such a long time been a misconception, like, oh, I have darker skin, I'm not a laser candidate. That's just not true. And I hear that from patients, but also I think we have to do a better job educating, because even I get sent a lot of patients from dermatologists who think that there aren't any treatment options for darker skin patients. So yes, we can treat darker skin, and you just have to be really careful. So a device that's safe to use is RF microneedling because you're not targeting pigment. So that's a great choice for skin texture, for tightening, that's safe to use in all skin types. And a lot of the resurfacing lasers, if you use the right settings, you can use them in darker skin too. And I feel like, and I don't want to speak for you, Mara, but I feel like I get a lot of patients who come to me because they're like, oh, you have darker skin, and I see on your Instagram or whatever that you have laser procedures done and you treat darker skin, so I feel comfortable with you treating me. So I feel like that's reassuring for patients to know, like I definitely have a lot of melanin, and it's safe for me to get laser treatments.
Yeah, 100%. I think you nailed it. So, educating our colleagues even on how safe they can be, these devices can be, and also bringing in that patient population who feels comfortable with their doctors who also have maybe a similar skin tone. One thing that I do, and I think for the viewers just to sort of educate on is, if you have scars on your body, like let's say, you scratch yourself or your dog scratched your arm the other day and, like it's healing a certain way, it's super important to show your doctor what that looks like. Like, what does it look like when it's healing? Because essentially these lasers, a lot of lasers we use, you can consider it as like controlled injury to the skin, right? And when the injury is not controlled, like a burn or a scratch, we want to see how that's healing. So if you've got something in your body, show us so that we can kind of dial in settings that would be most appropriate for your skin type. And then the second part is, so many people these days are mixed with so many different things, and it's just so beautiful how our culture has become more and more diverse. And I find that a lot of patients, like, we don't even know what they are. They could be very light skinned, but have the potential to hyperpigment. And so another thing I always do is ask, like, what's your background? What's your hair? Do you tan? Do you burn? What does your mom look like? What does your dad look like? These are all very important questions to ask and to inform, your doctor before you're being treated. Do you do a similar sort of
Absolutely.
inquiry?
Yeah.
Okay, perfect. And then you touched on something else where you said radiofrequency microneedling, does not target melanin, doesn't have a target chromophore. So what other devices are considered like colorblind or safe, because there's no target for them?
So devices like radio frequency or ultrasound, like microfocused ultrasound, those all don't have a target. Whereas with everything else, we're either targeting melanin or water or hemoglobin.
Yes, awesome. That's, I think, again, an important point, because a lot of darker skinned patients will sort of take themselves out of the mix and just focus on topicals. And even if you're, just getting to know lasers, if we have any residents on or anybody who's sort of like just learning about these technologies, you can start with these colorblind devices that they're still heat, so there can still be the potential for some pigmentary issues, but in theory they're safe because they don't have that target of melanin. And in my office we use things like cryolipolysis, like cool sculpting. We do all the time on darker skin patients very safely. Also a lot of ultrasound skin tightening. So I use the soft wave, which has worked beautifully for patients across all skin types. So just to put that out there as well. I'm just going to look through it. We're approaching 30 minutes, and I just want to look through and make sure that we didn't miss any questions. We have one from Sandra. She said she's turning 49 in 2 weeks. Looks like she's excited but terrified. I have big pores on my lips from acne. I'm a pimple popper. What can I do? Never had any fillers, Botox. And where are you located? Do you want to take that? Start with that one.
Sure. So I would recommend, and thank you for admitting you pop your, oh, hi guys. So I would recommend probably like a fractionated device to help with the enlarged pores. That would also help with the texture. You could do a Fraxel. And you could also I do like for acne scars, I do little droplets of filler or subcision to kind of break down the scars to plump them up. So there's many different ways to target acne scars. And what I tell patients is that oftentimes I have to mix and match those different treatments to get them their best outcome. It's not a one size fits all. And stop picking. We're all pickers, but you got to stop picking because it just makes you more prone to scarring, and then that becomes harder to treat. And I'm outside of Philadelphia.
Awesome. Yeah, I do the same. I think that with scarring, especially acne scarring, it is so true. It's not a one size fits all. And so, I'll often talk about a plan and outline, where to start, and then say, if we shift gears or, add another procedure, add a device, that doesn't mean that what we've chosen isn't working. It's just that we can, everything sort of meshes together and is additive. It's not necessarily because something went wrong with the first or we didn't get the right outcome. And I think that's important to note too, because often people, you sort of build a plan, and then when you change it, it can make the patient very uncomfortable, right?
Right. Right.
Awesome. So in our final few minutes, let's just see, are there any other questions? We'll just give everybody a second to sort of pick our brains last time. You know what we didn't talk about is laser hair removal.
Oh,
Yeah, so and I think that's important, especially if we are talking about laser and lights and darker skin. Can you just touch on, what you do with laser? Do you do laser hair removal and where do you
yeah.
what breed, what skin types?
We do laser hair removal in all skin types. It's all about using the right device, but also having someone who's comfortable treating all skin types. Because even if you have the right device, if your technique isn't good or if your settings are off, you can have complications. So it's really important to go to someone who's experienced treating darker skin. Also, try not to, don't be tan when you're coming in for laser hair removal. But I think it's a really popular treatment both for men and women.
Yes, same. I do a lot of facial hair, and a lot of, ingrowns along the jawline and neck in men especially. And it can be a game changer, but again, using the right device is very, very important, and finding the right dermatologist or provider that can do that for you. Um, do you ask patients to stop their retinoids before any procedures, any laser procedures?
I don't. I kind of tell them to keep using it when I'm treating them just because they're going to get better penetration. I have them stop it 2 days after and then restart.
Why do you have them days
Um,
after, just healing?
yeah, yeah, so that they don't have too much irritation. And I know most people don't do that, but I just think it increases the penetration of the retinoid and they get better results.
Yeah, yeah. And as we're talking about topicals, do you prescribe or give your patients like a pre and post topical skincare regimen?
I do. I mean, I give patients a lesson before and tell them to use it after just to prep their skin to optimize the outcomes from the laser procedure.
Yeah, perfect. I do as well. For us, we have them ordered online, because we don't have products for sale in the office, but they'll order online and then bring it in. And that's another really important point is the skincare that we've been talking about pre and post, to really skincare to optimize your healing and your outcomes. So
Yeah.
and I keep saying this but I was just waiting for more questions to come in. Is there anything that I didn't ask or anything that you wanted to say as like the final, like the closing statements, or anything that you feel like our viewers should know after this session?
Yeah, I think that one thing they should know is that you shouldn't be afraid to start these treatments early on, especially if you're going to someone who's experienced and knows what they're doing. Because I think that people kind of shy away from doing cosmetic procedures early on, thinking they're not going to look natural or that it's going to do something damaging to their skin. But the reality is that you are getting rid of sun damage and helping your skin look younger and rejuvenate it so that you don't have to do as much heavy lifting later on.
That's right. So start early, stick with it, get yourself on a maintenance plan, find an amazing doctor like Dr. Sadie in Philly. And if
Or what?
you if you don't have a board certified dermatologist or laser expert to treat, and you're looking to find one, you can look on the ASDS website. The website is asds.net/find, and you can search your zip code, and a whole bunch of board certified laser experts, derm surgeons will pop up, and give one of them a call. You can also reach out to Dr. Sadie and I on Instagram, and we'd be happy to point you in the right direction. So on behalf of the the ASDS Skin MD IG page and the ASDS, I would like to thank all of you for joining us. And this session will be recorded and available on the ASDS Instagram page probably within the next few days. So thank you all, and thank you so much, Dr. Sadie, for your time.
Thank you
And
so much for having me.
of course, and we'll talk to you later. I'll talk to you soon.
Yeah, talk soon.
Bye.